Hello, and this is Dr. Corey King from AskDrKing.com. I am board certified in integrative medicine, and my passion is helping patients heal faster and with less heartache. And in today's video, we're going to be discussing healing the gastrointestinal tract and why that is so important for those who are struggling with thyroid gland disorders. Okay, let's go ahead and begin jumping into the discussions of the gastrointestinal tract. I talk about this a lot. I feel like I talk about it ad nauseum with every single patient I work with because it is so vitally important for patients to heal the gastrointestinal lining. When I was 20 years old is when I realized that I was struggling and suffering from leaky gut syndrome and IBS. That was many, many years ago, and back then nobody was discussing leaky gut syndrome. Nobody had any products for it. Nobody was talking about eating a special way to help the gut lining heal. So it took me about 2 years just to heal my gastrointestinal lining. Now, if you're struggling with a chronic gastrointestinal dysfunction or disorder, don't worry, it doesn't take 2 years anymore. We've got it down to about 90 to 120 days for most patients, barring any infections. If you're a chronic gastrointestinal patient, then it may take you a little bit longer. But for a majority of my thyroid patients and our Hashimoto's patients, it's going to be about 90 to 120 days. So we're going to do a little 3-part series here on the steps that you need to do in order to make sure that the body is not creating this inflammation within the gastrointestinal tract. Step number 1, this is going to involve making sure that there is nothing that is destroying or creating inflammation in the gut. Now, how are you going to know if that's occurring? Well, here's a checklist for you. Let's go with the first one, foods. There are tons of inflammatory foods. We launched our online course called The Fundamentals for Healing. I'll put a link in the description below. I actually take you by the hand and teach you exactly what you need to do in order to clean up your lifestyle. But in that online course, I give you a list of the foods to eat, the foods to avoid, how to substitute certain foods for the ones that you're wanting to stay away from. I even teach you how to reintroduce your foods. But there's a list of foods that you must avoid in the beginning to begin healing your gut. So yes, foods are going to be one of the triggers that can create inflammation of the gut. And if there's inflammation of the gut, my favorite saying is if there's inflammation of the gut, there's inflammation of the brain. Or better said, if there's a fire in the gut, there's fire in the brain, meaning that is what's going to be causing patients brain fog. So if you're struggling with brain fog or the lack of focus and clarity, a lot of times that is coming from the gut. It's not always in the brain, meaning the doctors need to give you a medication for the brain specifically. Go to the gut. Whatever happens in the gut happens in the brain. So we've got our foods. Then we can talk about things like toxins. The toxins can come from herbicides, pesticides, insecticides, BPA. That's why we love talking about getting BPA-free water bottles when you're drinking water. It can come from plastics, heating plastics up because they leach these chemicals into the foods. So you've got to watch out for the toxins. Mold is another one. We found mold in my better half Natasha's gastrointestinal lining from that black mold that we were exposed to in our old home in Laguna Beach, California. So we've got our foods, we've got our toxins. Stress, that is a big one. Stress is going to create more cortisol to be released. When more cortisol gets released, it starts to not only cause the brain fog, but it will eat away the gastrointestinal lining. And what you need to know about the gastrointestinal lining is it's only one layer deep, meaning if you look at a home and you've got all these bricks, just imagine a red brick home. So if you've got all these bricks that are stacked on top of each other, it's really hard to destroy the home by destroying a couple of the bricks because you've got so many layers there to support the home, not to mention the foundation. But if you take your gastrointestinal lining, it's only one layer deep. So you start to destroy some bricks. Now there's going to be these holes in between the bricks. Now undigested food, medication, supplementation, all that's going to pass the gut barrier, get into your bloodstream and create inflammation. That inflammation, once it's in your bloodstream, now it gets circulated throughout the rest of your body. So that can affect the brain, it can affect other organs, it can affect your muscles and your joints. it can just make you feel crummy. So your gut lining is one brick layer deep, if you will. So you've got to make sure these triggers like the stress and the cortisol and the food and the toxins, and there's medication that can eat away at the gastrointestinal lining. I mean, most people know that antibiotics destroy the good gut flora. And the good gut flora, the good bacterium, they're there to help you absorb your vitamins and your minerals, but I call that the paint, meaning that's just like painting over the brick. So if you're painting probiotics, if you're painting these bacteria over the bricks, but you're not filling in the holes, this is why patients can be on probiotics for years and their gut lining doesn't get healed. So we've got our foods, we have our medications, we have our toxins, we have our stress, and the other one, infections. And I've talked about this before, but bacterial infections, parasitic infections, fungal infections such as candida or yeast overgrowth, all of those will break down that gastrointestinal lining. So you've got to go after all the triggers first, see if they are there, because these are pieces of your health puzzle. That's how I want you to think about it. You've got to get all the pieces to your puzzle put together so then you can come up with a game plan. If you leave some of these pieces off the table, man, good luck. It's going to be really hard to help heal your body. And your gastrointestinal tract, that's 80% of your immune system. 80% is located right there. So it would behoove us to go in there and look for these triggers. How do you look for the triggers? Well, there's all these specialty tests that can be ran. You know, you can run a white blood cell panel with a differential. Super easy test. It costs $30.44 going to my lab. There's breath test if we're concerned about things such as H. pylori. And then we can run what are called stool tests. So not the most fun test to do, but stool tests will dig a little deeper, no pun intended, into seeing what type of infections could be there. Most gastroenterologists, a lot of them, I should say most, but a lot of them miss some of these common infections because I see their patients. I work with their patients. So there's some cool specialty tests that can be done. And we can also base things off of symptoms as well. So if you're concerned about your gastrointestinal tract and you're worried about some of these triggers and you need some help figuring this stuff out, I consult with patients domestically and internationally. My information will be below. This is only the first part of our little 3-part video series on the gastrointestinal tract. So make sure you catch the next installment because we're going to dive a little deeper into what else you need to be thinking about to help heal this gastrointestinal disorder. So first we got to talk about the triggers, which is what we did today. You got to figure those suckers out. Once you figure them out, then you got to talk about how to get rid of them. So that's what we'll discuss in our next video. Question of the day for you. Put your comments below the videos. I love to interact with you viewers. So question of the day is, have you been diagnosed with a gastrointestinal disorder? And if so, has anything helped you so far? And if nothing has helped you, what have you done that just hasn't worked yet? So put your comments in the section below. If you enjoyed the video, give it a and make sure to share it with somebody that you think it could benefit. And I truly look forward to seeing you on our next video.